Hello everyone, this is Dr. Kouros, and today the topic of discussion is to raise awareness about so many different health issues that your kids might be facing today. And we actually address a lot of it in our practice, and I wanted to point out a few things to you guys so that you are able to see if these are some of the symptoms that your child is experiencing, and if so, please do bring them for a consultation so we can help them. We've had so many patients over the last several years that have come to our practice with their kids having these certain issues. If your child is experiencing bedwetting issues, and they could be 4, 5, 6, 7, or 8 years old, and they're still wetting the bed, guys, these are some sleep-related issues that we can address. I've had patients who have gone through a neurologist, ENTs, and urologists to be able to address these issues, and yet it comes down to some sort of a sleep-reading disorder that can be addressed at our practice. Now, how do you address it? If your child has a bit of a tongue restriction or their jaw is not developing properly, this can impact them in the way they sleep or the oxygen level that they're receiving. So if they're having bedwetting issues, if they clench or grind their teeth, if they're snoring, if they have difficulty focusing in school or they're placed on ADHD medication, if they're overreacting or hyperactive, if you cannot get their focus and attention, especially with you parents these days. I know during post-COVID time you have to kind of stay home, or you've had to kind of stay home and teach them online learning in school. It has been a little bit of a troublesome, and of course we appreciate our teachers so very much because they have to deal with our kids every single day, right? So if your child is experiencing any of these symptoms, or they have possibly repeated ear infection, or they have enlarged tonsils or adenoids, or they're not growing properly, according to the pediatrician, they're in the lower percentile, guys, we can help your child, okay? So if your child is experiencing any of the above symptoms or more, and it don't have to be all of them, it could be just one of those symptoms, it could be snoring, it could be bedwetting, it could be clenching or grinding their teeth, it could be enlarged tonsils. We have a way to not only find out what the source of the problem is, but also be able to address those issues in so many different ways that we have, those so many different possibilities that we have in our practice in order to help improve your child's health, not only for this short time, but obviously the quality of life when your child doesn't have to take medications, or later on have to deal with these issues of having to have cavities or restoration in their mouth. The overall quality of your life changes as well. So we are here to help you and help your child improve, and please stay tuned because I have more educational videos and things coming up in the next several weeks that will discuss what also happens to these kids who are not, their concerns are not addressed at a young age, and what happens if they go to adulthood, and what type of medications or necessarily surgeries they have to go through in order to be in a little bit of a normal state, but yet the underlying cause of this issue is still not addressed. And we have become a society that it's okay to take so many medications, and it's become this vicious cycle, and hopefully we are here to address some of these concerns and be able to address what the root cause of these issues are in order to prevent so many patients, so many kids and adults who are suffering these days because of not only our diet and nutrition and of course processed food, but also so many other underlying causes such as sleep-reading disorder, tongue restriction, lip ties, tongue ties, parents having difficulty breastfeeding. So there's so many different issues that our kids can face these days that if diagnosed at an early young age, it can be prevented and it can be corrected, and it doesn't have to go into adulthood. However, if you have these symptoms such as adulthood, such as headaches, migraines, or sleep-reading disorders, or issues with having to take high blood pressure medication or cholesterol, or you're diabetic, we can still help you. Please call us for a consultation so we can address some of these concerns you may have. And if I don't have an answer, I promise you, I'm the kind of person, I will find answers for you. I'll work with collaboration with neurologists and speech pathologists, lactation consultant, urologists, in order to help heal my patient for the better. And I hope that I can be out for you for the quality of your life, for the success of your child and your journey as well. Please stay tuned for our next week's coming video, and I'm here to help you as always, Dr. Kouros, and Melanie Smiles team. Have a nice day.